So a really important lesson that was taught to me in training was you can set expectations without prognosticating. What does that mean? If you have a patient with COPD on 6 liters of oxygen all the time, dependent on dialysis 3 times a week, with heart failure, and they can't walk more than a block without feeling like they're going to pass away, there's some level of expectation setting that should be done. And I think the fear is you don't want to be that doc who says, like, you have 6 months to live, and then they live for 7 months, and then they sue you. But, like, oftentimes that's not what patients are even asking, right? They'll be like, oh, can I go to Italy for a week and see my extended family? No. But it's inappropriate for me as the ER guy to say this after meeting them for one visit. These are often things that are deferred to palliative, which is an underutilized resource, sure, but they don't have to be like the difficult conversation team. You can do some of that yourself. And they don't have to be on hospice because, of course, palliative and hospice are not the same thing. But I've had some pretty frank conversations with people, of course, not actual patients, right? But to say, like, Mr. Jones, what do you think would happen if you don't get dialysis for a full week or even a single session? You've come to the ER for that before. You fill up with fluid where it doesn't belong. You're on oxygen. You're terribly uncomfortable. Your blood pressure is like 1 billion over 1,000, right? That's not a sustainable thing. So I end up having these many conversations in the emergency department, and it ends up being like, well, unfortunately, you're not going to be able to go travel 3,000 miles to another country because your life depends on the care that you have here. But what do you have? Oh, your grandchildren are local. You can see them. You have family that can come to you as the matriarch or patriarch of your family, right? So I feel like it's so important that as a provider of people who are approaching end of life, the timeline of it, you don't need to be clear about, but setting some kind of reasonable expectation of what their life might look like in the final months is so important, and you can't ignore that.